This Reach You Project documentary is made possible by the generous support of the American people through the United States Agency for International Development. The HIV epidemic remains a serious public health problem in Uganda. According to the UNAIDS report 2011, it is estimated that about 1.4 million people are living with HIV/AIDS in Uganda, of whom 190,000 are children. Annually, there are 124,000 new infections and approximately 69,000 Ugandans have died of HIV. The current prevalence is up from 6.4% in 2005 to 7.3% in 2014 among the adult population. This is a worrying trend as majority of Ugandans do not know their HIV status. According to the Uganda AIDS Commission, the country is getting ahead of the epidemic and has started reversing its pangs. In 2013, Uganda saw a 14% reduction in the new HIV infections from 160,000 in 2011 to 137,000 in 2013. Notably, the number of newborn babies testing HIV positive reduced drastically from 28,000 babies born with HIV in 2011 to 8,000 babies in 2013. Also, the deaths caused by HIV reduced by 15% in the same year, from 66,000 deaths in 2011 to 56,000 deaths in 2013. HIV counseling and testing has been prioritized as a key component of HIV prevention and care programs globally and nationally. The Ugandan president has supported this cause.
Testing is in your interest because once you test, if you find you are positive, then you start using the ARVs. If you are negative, then you know that you are all right and you avoid risky behavior.
It is in the same spirit that the American people through PEPFAR and USAID in contributing to prevention and care of HIV persons came up with programs to work through partner governments to support a sustainable, integrated, and a country-led response to HIV/AIDS.
HIV/AIDS makes no distinction and knows no borders. Get tested. By knowing your HIV status, you can take control not only of your own health, but the health of those around you.
In August 2009, MJAP was awarded a 5-year cooperative agreement by the American people through USAID to scale up HIV counseling and testing in 22 districts of Uganda through a project codenamed Realizing Expanded Access to Counseling and Testing for HIV in Uganda, Reach You. Reach You is a program that supported the Ministry of Health in scaling up HIV counseling and testing services. As the National HCT coordinator alludes, HIV counseling and testing was a challenge.
Stigma at that time was very high. So people would only go to test when they have suspected, mainly when they are fallen sick. And by the time a person feels or gets sick to that level, it's more likely that many people have been infected from that particular person.
Reach You's ultimate goal was to identify HIV-positive persons early enough so as to link them to care and treatment and to contribute to primary HIV prevention. Initially, the project operated in 22 districts. However, in 2011, following the PEPFAR geographical reduction in the scope of the Reach You project, the focus was directed to 10 high-prevalence districts that are hard to reach and with most at-risk populations in a bid to improve efficiency in service delivery. They included Abim, Kotido, Kabong, Moroto, Napak, Nakapiripirit for the Karamoja sub-region, Mokono, Wakiso, Rakai, Liantonde in Central Region.
If you look at districts in Karamoja, for instance, The road network is very poor. That time Karamoja was very insecure. That was the time when government was conducting the disarmament exercise, and so there were pockets of insecurity. So people are not very free to travel to some of those areas in Karamoja for those two reasons that I've given you: insecurity and then the poor road network.
The main goal of the project was to contribute to the national efforts of increasing access to quality HIV services. REACH-U mainly offered services to MAPS, that is, most at-risk populations, now known as key affected populations, especially commercial sex workers, couples, uniformed personnel, fisherfolk with their communities, and truck drivers, among others. The challenge was that most of these categories of clients were hard to reach, and access with services was not easy. REACH-U, through its interventions, carried out physical searches, thereby extending services to workplaces and residences of the most at-risk populations. To reach out to busy sex workers and truckers, the project used a strategy of moonlight testing, and these groups were found in their workplaces and their homes. The fishermen were identified from their fishing villages and landing sites. To increase demand for HIV counseling and testing, demand was created through edutainment, community radios, radio talk shows, community dialogues, and working with communities or village health teams, among others. The project has left a mark by contributing to strengthening national systems for planning and supervision, coordinating and reporting in districts and health facilities.
The systems have become stronger. They have become more interlinked. It is easier now to get service delivery. Drugs working with the national medical stores can come to Karamoja, some that was hitherto very hard and unknown.
We are happy that people no longer fear to come out and test for HIV. We are happy about the quality of services that we've been offering. We've been doing quality controls, ascertaining or being sure that the results we've been giving to our clients are of quality. But also the quality of counseling, that people no longer commit suicide, for instance. We've not heard of a case in any of our supported sites that someone has committed suicide due to knowing they're HIV positive or any of their results. So we think the quality of counseling has been good.
Strengthening referral for people who test for HIV and linking them to appropriate services like care and treatment and prevention services. The project has also provided information to people and encouraged them to test. Today, people are demanding for the services. The project trained and equipped health center staffs with skills of testing for HIV and giving quality results to the people. This greatly impacted on their motivation and has helped to increase the number of people that know their HIV status. Today, you can walk in any REACH-U supported health center and you will know that you will get a quality HIV test. In these trainings, demonstrations and practical experiences were done to equip service providers with HIV testing and counseling skills.
The REACH-U program has been able to train healthcare workers in all the over 100 facilities where we are working. And we are proud to note that all those facilities, whoever gets in those facilities will be able to get out with an HIV test.
The success of REACH-U was premised on the strategy that was employed. The implement strategy involved the total participation of local and district leaders, like the chief administration officers, COWs, chairpersons of LC5, the health teams, health unit management committees, sub-county leadership, and others.
We have been working hand in hand with the REACH-U as a project. We had a number of meetings in Kotido introducing us to this project, and by so doing that, we went ahead to mobilize communities, telling them that this kind of project will help us come out of the disaster HIV status. Those who are sick can be able to know their HIV status, and those who are not sick can be able to avoid getting infected.
This helped in mobilization of the locals and proper dissemination of messages among people, leading to ownership of the project activities by the communities. Some of the hard-to-reach areas included islands of Lake Victoria in the districts of Mukono, Wakiso, and Rakai. The islands included Busi, Kome, and Musambwa, among others. They have unique challenges, and reaching them made a world of a difference to many of them that hardly found an opportunity for an HIV test.
Ku kizinga ekitibwa Musambwa Island, kizinga kyetongode kiri mazzi ega Lake Victoria mu nsalo za Rakai district, era nga kibeerako abantu abakkirizibwa mu butongole okubeerako. Kirina ebyafaayo bingi nti okusooka n'okuyitibwa erinnya erya Musambwa kyali kirinako ebyobuwangwa bye baali bakiteekako, era ebimu nga bikyakuumibwa. Ekyokulabirako nti wano waliwo abantu abasukka mu 300 olwaleero, era nga temulimu mukazi n'omu bw'ati yadde ajja okufumbirayo, yadde azze okukyalayo tukubeerako mukazi.
Busi Island is one of the remotest and hard-to-reach islands in Wakiso, despite the district being a heartbeat away from Kampala, the capital city of Uganda. It's a journey only for the brave, sitting on the boat for at least 4 hours past the stormy waves and calm waters. Transport on the islands is a nightmare. The means of transport are unstructured. At this time, we got lucky to use this only taxi on Busi Islands, or this old truck from Kome, and sometimes we would use border borders, and many times our teams walked. Like many islands, the population here is a fisherfolk community living in clusters in isolated locations. They are also considered a high-risk community because of their sexual behaviors.
Ngafa abavubi obuvubi bwe tufuna. Abasajja tuli bangi ate abakyala baki batono. Nusanga ng'omukazi omu aliko abasajja 5. Okiraba?
There are more men than women on many islands. That leads to sharing of women, hence increasing the chances of getting an HIV infection.
We women of Busi, we mostly, in that we are trying to find for better survival. You can find that your husband cannot provide every need, so you have to get another side dish to help you in that. Maybe if your husband can support you with the money for hairdressing, you find another one to give you jelly, you find another one to clothe you. That's the situation we are in.
The isolation makes it difficult for them to access basic services, including HIV prevention services. When we pitched camp, we also mobilized the community to turn up for counseling and testing. One by one, they trickled in as numbers grew to hundreds. We counseled, gave results, and contributed to primary prevention of HIV.
You cannot begin the fight of HIV unless people know their HIV status. You test them. So when you test them and you find that they are negative, then you give them HIV prevention messages. That is being faithful, abstaining, using condoms, going for circumcision, and many other services. If they are HIV positive, then you know what to tell them. You can go ahead and seek early care and treatment.
Vulnerability to HIV stems from the time the fishermen and the fish traders spend away from homes and from the main islands fueled by the access to quick and dangerous money. The story of Rose from Busi Island sums up the ritual journey on many islands. Like Rose, many women have contracted the virus not because they intend to, but because the way of life dictates so. Rose, a 35-year-old and a mother of 3, contracted HIV from her husband after their second baby. 2 years ago, she was tested during our outreach to the island and discovered that she was HIV positive. At that time, Rose was 2 months pregnant. We advised Rose to start on antiretroviral treatment and to learn how to prevent her baby from contracting the virus. 2 years later, she can smile because her baby is free of HIV, having tested earlier.
Mbakubiriza abasuubira nti balina akawuka ka siriimu bekebeze kubanga nze nkyenyumiririzaamu kuba mmira eddagala lyange bulungi nnyo era nemba n'obulamu era lwe mbasirimize kale era mba mpulira ng'obulamu bwange buliko ekikyamu kubeera buli lwe ndimira sobola okukolerera abaana bange nemba n'amaanyi agabakolerera.
From the islands of Lake Victoria, navigating through 12 districts to the flat plains of Karamoja, Reach-U project has broken through the barriers to all the districts in the sub-region. Previously closed out to the rest of the country, Karamoja had a low HIV prevalence of 2.3%. Today, the area is slowly opening up to the world as more development partners, NGOs and investors pitch camp. This opening up has come with its own share of a burden on the population as the prevalence has risen to 5.3%, shy of 2% of the national average of 7.3%. This is a concern that must be addressed urgently. The Karamojong have a closed and secretive lifestyle. This is partly due to the security history of the region. Getting access into the Manyatas with services was, until the Reach-U project came on board, a very daunting challenge.
There were very few organizations